Hello, good morning, guys. So today we are going to talk about antibiotics. So how we are going to treat the different kinds of bacterial infections. So remember that antibiotics are used to treat bacterial infections. So we have different types of antibiotics. We have aminoglycosides, cephalosporins, we have fluoroquinolones, macrolides, lymphocymides, monobacterium antibiotics, penicillins, penicillinase resistant antibiotics, sulfonamides, tetracyclines, and lastly, the antimicrobacterial antibiotics. So these are the different types. Each of them has different kinds of action and they treat various forms of bacterial infections. Now we go first to aminoglycosides. So as you can see here, we have different types of amino or brands or generic forms of aminoglycosides. We have amikacin, amikin, gentamicin, garamicin, kanamycin, Cantrix, neomycin, mycifradin, streptomycin, which is a generic, tobramycin, Nebsin, or Tobrex. As you can see here, aminoglycosides, they have a common suffix. It's either mycin or mycin with an I. So these are the aminoglycosides. Action, they are bactericidal because what they do is they inhibit protein synthesis, which leads to the loss of the integrity of the bacterial cell wall. If that happens, once the bacterial cell wall becomes weak, all of the cellular contents, like what I've discussed from our previous lecture, are going to leak out of the bacteria, causing or ultimately leading to its death. So it is bactericidal. It weakens the cell wall, it loses its integrity. That's why it somehow pops up. So notable side effect, most especially that of streptomycin, is it causes autotoxicity. When we say autotoxicity, this means that the patient who takes in streptomycin may experience ringing of the ears or tinnitus, like the one that is being experienced also with the intake of aspirin. Next, now we go to the cephalosporins. Cephalosporins, we have four generations of these, and they can treat a wide variety of bacteria. Starting out with the first one, there are a few bacteria that it can treat. Second, additional bacteria is or bacteria, yes, is added into it. Third, more bacteria can be treated until the fourth one. With the first generation, I need you to remember this mnemonic because first generation treats both gram positive and gram negative bacteria, such as the following. They are in a mnemonic known as PEC. We have Proteus mirabilis, E. coli, and Klebsiella pneumoniae. So if you have respiratory infection brought about by these different kinds of bacteria, you can be treated with the first generation cephalosporins. For the second generation, three more species are added. So for the first, only three species are there. Now for the second generation, additional three. So a total of six types of bacteria can be treated with this second generation. It treats Haemophilus influenzae, Enterobacter aerogenes, and the Neisseria species like Neisseria gonorrhoeae and Neisseria meningitidis. So remember henpeck. Henpeck. So we have Haemophilus, Enterobacter, Neisseria, Proteus, E. coli, and Klebsiella under the second generation. So, question: if a patient has gonorrhea, Will it be treated by the first or by the second generation of cephalosporins? It is not going to be treated by the first one, but it can be treated by the second, third, and fourth. If a patient is suffering from a sexually transmitted infection, such as gonorrhea, because gonorrhea is under the Neisseria species, which is Neisseria gonorrhoeae. If you if you are already here in your microbiology class, you are going to discuss the different types of bacteria, and antibiotics are the ones being used to kill them. Now we go to the third generation. They are weak against gram-positive bacteria, but they are more potent against gram-negative, as well as Serratia marcescens. So remember henpex. Henpex. So there are now 7 bacteria being treated by the third generation. So additional one is VS, henpex, which is Serratia marcescens. And fourth generation cephalosporins are still being developed. There are newer batches of cephalosporins under the fourth generation that are being developed by pharmacologists and other scientists. Now, examples of the first generation cephalosporins are the following. We have cefadroxil or Duricef, cefazolin, Ancef or Zolicef. The common one in the first generation would be cephalexin. That's why I highlighted it. Cephalexin or Keflex or Biocef, and Cefradin, Velocef. I've tried taking cephalexin before, brought about by upper respiratory tract infection. Now, for the second generation, we have cefaclor, seclor, cefmetazole or cefazone, cefoxitin or mefoxin, cefprozil, cefzil, and cefuroxime, cefkin or zinacef. So, if you have been infected, let's say, for example, with Neisseria gonorrhoeae or gonorrhea, any of these drugs, cefuroxime or cefoxitin, which is the common ones here in the Philippines, can be used to treat them. But doctors here in the Philippines prefer this one. It's more effective against gonorrheal infection. The third generation of cephalosporins. Cefdinir or Omnicef, cefoperazone or Cefobid, cefotaxime or Claforan, cefpodoxime or Vantine, ceftazidime or Ceptaz, ceftibuten or Sedax, ceftizoxime or Cefizox, and ceftriaxone Rosifid. And ceftriaxone is the one that is being used to treat, or it is used aggressively to treat gonorrheal infections. For the fourth one, we have examples such as cefditoren, Spectracef, and cefepime, Maxipim. And with regards to the different generations of cephalosporins, the higher the generation that has been prescribed to the patient, the more expensive the drug is going to be. So that is, or these are the different types of cephalosporins. Remember their common prefix, which is ceph. It always begins in ceph. What are they? What are their action? It is both bacteriostatic and bactericidal. So bacteriostatic, when we say bacteriostatic again, it prevents its proliferation. It prevents it from further multiplying. At the same time, it also kills the bacteria. So the most common adverse effects are nausea, vomiting, diarrhea, anorexia, abdominal pain, and flatulence. When we say anorexia, that is loss of appetite, but that doesn't mean that the patient has that psych disorder, anorexia nervosa. That's different. When we say anorexia, that is pertaining to loss of appetite. Anorexia nervosa is different from this. And be careful when giving cephalosporins because large doses of this can cause nephrotoxicity. So it is toxic to the kidneys. So be very, very careful when administering or when making computations for cephalosporins. And take note, When we are teaching the patient to take cephalosporins at home, we advise the patient to avoid any form of alcoholic beverages because it can have a disulfiram-like reaction. So we advise the patient receiving cephalosporin not to take any form of alcohol. Or if they stop taking cephalosporins, let's say, for example, the doctor has prescribed for the patient to take cephalosporins for at least 14 days. Once they finish the 14-day period, they should wait up to 72 hours after discontinuing the drug. Or else, let's say for example, today's the last day for them of taking cephalosporins and they decided to take an alcoholic beverage such as brandy or gin the next day, they will still have a disulfiram-like reaction. Disulfiram is a drug that is used to treat alcoholism. We'll go to that later on once we are in psychopharmacology. Now, if a patient takes in alcohol together with cephalosporin, it will have this reaction, which has signs and symptoms of flushing, throbbing headache, nausea and vomiting, chest pain, palpitations, and dyspnea. So it's as though the patient is suffering from a heart attack if they are mixing cephalosporins with alcohol. So we advise patient not to take this cephalosporins with alcohol, or else they are going to have a hard time experiencing these signs and symptoms. And tell them if they have stopped taking cephalosporins, they should wait at least 72 hours or 3 days before taking in an alcoholic beverage. Now we go to the fluoroquinolones. We have different types, different names: ciprofloxacin, cipro, gemifloxacin, factive, levofloxacin, levaquin, lomifloxacin, maxaquin, moxifloxacin, avelox, norfloxacin, noroxin, ofloxacin, floxin, and ocuflox, and our sparfloxacin, zaga. So as you notice here, the common suffix is floxacin. Floxacin. What are fluoroquinolones? The action is to interfere with the DNA enzymes inside the bacterial cell wall, which is necessary for bacterial growth and reproduction. So they are bacteriostatic. Bacteriostatic because they prevent the bacteria from reproducing. And they are indicated for infections of gram-negative bacteria. Common adverse effects are headache, dizziness, insomnia, and depression. So you need to note those things under fluoroquinolones. Remember, guys, fluoroquinolones are bacteriostatic antibiotics. Now we go to the macrolides. Macrolides, we have the following: azithromycin, Eritab or Eric, azithromycin, Zithromax, clarithromycin, Biaxin, and erythromycin or Dynabac. These are the different forms of macrolides, and they also have a common suffix, which is thromycin. One of these drugs, azithromycin, can be given as a single dose antibiotic. And the good thing of this is that if you are treated with azithromycin, since it's a single dose, it's convenient for you to take this if you have a bacterial infection because you don't need to be reminded of taking it again and again every day. For azithromycin, it's a one dose drug. It's a drug wonder because it can help treat bacterial infection with just a single dose. And action is both bactericidal and bacteriostatic. Again, they're also indicated to various types of bacterial infections. But take note, Large doses of macrolides can cause hepatotoxicity. So they can cause liver damage. So we need to monitor that the liver enzymes, such as the AST and the ALT, when giving macrolides. And when we give oral azithromycin, we need to advise patients to take it 1 hour before meals or 2 hours after meals for optimum absorption. So you should have an empty stomach when taking azithromycin, because if you take it with food, it will slow down its absorption. Now we go to the lymphocymides. We have clindamycin, cleocin, lincomycin, and lincosin. Their common prefix is again mycin. Mycin, such as same with the aminoglycosides. These medications are similar to macrolides, but they are more toxic. But they are effective against the same strain of bacteria that the macrolides treat. But they are seldom um, seldom prescribed by physicians because they are more toxic than macrolides. Now we go to the monobactam antibiotic. There's only one generic name for this. We have aztreonam or azecam. The action is to disrupt the cell wall synthesis. So again, it will weaken the cell wall, leading to the leakage of the bacterial cell contents. So it is bactericidal now, and it's indicated for various forms of infection as well. These are the monobactam antibiotics. Example is Astronel. Okay, now we go to the first type of antibiotic that has been produced, penicillins. Together with, of course, the penicillinase resistant antibiotics. This was the first antibiotics introduced for clinical use. And it was Sir Alexander Fleming, an Englishman, who used or who discovered it by using penicillium molds. Remember the scientific name of the mold that is being used to produce penicillins? That is Penicillium chrysogenum, which was formerly named as Penicillium notatum. Now it's now known as Penicillium chrysogenum. So this was first discovered in the 1920s. And action of these medications are interfering again with the cell wall synthesis. So it's more of bactericidal. And they can treat various types of infection. So examples of penicillins that we have here, we have the generic, which is penicillin. We have amoxicillin, amoxil, trimox are the brand names. Ampicillin, Principen. Carbanicillin, geocillin is the brand name. Ticarcillin and Ticar. Now we have also the penicillinase resistant antibiotics. There are certain bacteria that can be resistant to penicillins. This occurred over time because of disregard for patients disregarding the intake of penicillins. When these things happen, such as they do not observe the proper drug schedule of these antibiotics, some bacteria can produce or can have resistance against penicillins. And they will produce enzymes such as penicillinase. Some bacteria can do that. They have evolved to resist penicillins. And they start producing penicillinase. That penicillinase is an enzyme produced by bacteria to counter the penicillins. Now, since humans are smarter than bacteria, humans have invented penicillinase resistant antibiotics such as nafcillin and oxacillin. So take note, always remember, guys, when we are administering antibiotics, the different kinds of antibiotics, one of our nursing responsibilities is for for us to teach the patient to adhere to the drug schedule. If the doctor has said for penicillin to be taken 10 days, it should be strictly taken within the next 10 days. Tell the patient that if the signs and symptoms go away, such as for upper respiratory tract infection, just tell them to finish the drug schedule, or else some of these bacteria can produce resistance against the different forms of antibiotics. Now we go to the sulfonamides. Sul or sulf are the common prefixes of sulfonamides. So these are the drugs that inhibit folic acid synthesis, which is necessary for the synthesis of DNA and RNA in the bacteria. So it's interfering with the creation of DNA and RNA inside the bacteria. Remember, folic acid is needed to produce these molecules. And examples of sulfonamides are the following. We have sulfadiazine, which is a generic. Sulfasalazine, gantricin is the brand name. Sulfasalazine, azolpidine. We also have cotrimoxazole, Septra or Bactrim. And they can also be used to treat various forms of infection. Now we go to tetracyclines. We have their common suffix is cycline. And examples are, of course, the first one, tetracycline, somycin is the brand name. Demeclocycline or declomycin, doxycycline or Dorix, minocycline or minocin, and oxytetracycline terramycin. Always remember their common suffix, which is cycline. Let's say a patient is suffering from an infection brought up. It's caused by rats, and like the season that we have nowadays, it's the rainy season. If you are the type of person who loves wading into floods, you are going to, and you have an open wound, for example, you can be infected with this type of bacteria. And if you have been infected by this, it can enter, or before being infected by this, it can enter your open wound, since these bacteria are present in the urine of rats. So this bacteria known as Leptospira interrogans, if you have been infected by this, of course, you're going to be having leptospirosis. This can later on cause kidney damage. So in order for you to be treated with leptospirosis, just a zoonotic disease, because it came from animals, from rats, you are going to be treated with a common drug for leptospirosis known as doxycycline. So here, they inhibit protein synthesis, leading to the inability of the bacteria to multiply. So in short, they are bacteriostatic drugs, and they can treat a wide range of bacteria. And it is, again, hepatotoxic. So watch out for the liver enzymes, and take note, they are not given to children who are less than 12 years of age, because it can weaken both the teeth and bones of children. And they are not also given to pregnant mothers, because they can cause teeth and bone deformities in the fetus. So take note, this drug is not given to children because it can weaken both their teeth and bones. And they should not also be taken with milk. So it has a negative drug food interaction. Tetracyclines should not be taken with milk because calcium will bind with these drugs and will prevent it from being absorbed in the GI tract. So avoid taking them with milk. Okay, now we go to the drugs that are being used to treat pulmonary tuberculosis or leprosy. Now we go first to the anti-tuberculosis drugs. As you can see here, there's a mnemonic, right? RITE, right? We have rifampin or rimectin, which is the brand name, isoniazid, INH, nidrazid, pyrazinamide, which is a generic, and ethambutol, myambutol. So these are drugs being used to treat tuberculosis. And take note, unlike of the previous antibiotics that I have mentioned, these drugs are used for several or are being used to treat tuberculosis for several months. It can take up to 9 months for the patient to take these drugs every day. They can take up to 4 or 5 drugs per day. Like this one, right? These are 4. They will they will take all 4 of these drugs in order to treat tuberculosis or to kill Mycobacterium tuberculosis in their system. So remember, right? Sometimes streptomycin is added into the drug regimen. So we have rifampicin or rifampin, isoniazid, pyrazinamide, ethambutol, and streptomycin. So, right. For the leprostatic drugs, these are drugs that are used to treat Mycobacterium leprae. We have dapsone and thalidomide. Take note, thalidomide is not given to pregnant mothers because thalidomide causes deformities in the fetus. It can cause amelia in the growing fetus, most especially during the first trimester of pregnancy. If a mother has taken thalidomide, the consequence is that there will be a loss of limb from the fetus. So the limb is not going to grow. So there will be an absence in one or both limbs, either upper or lower extremities. So thalidomide is not given to pregnant women. So most medications, they act on the DNA, which leads to lack of growth and cell death. Now we go to the side effects of the anti-TB drugs. Take note, if the patient is taking in rifampin or rifampicin, we are going to advise the patient that red-orange secretions are normal. So if the patient has red-orange urine, red-orange sweat, red-orange feces, red-orange saliva, these are normal occurrences. It's the side effect of rifampicin. Isoniazid, patient will complain sometimes of peripheral neuritis. These are the tingling or numbing sensation of the extremities. It's as though your hands or the feet are being somehow grounded or electrocuted mildly. To put it in Tagalog, yan yung nakukuryente yung kamay ninyo. Pyrazinamide can be hepatotoxic. So watch out again for the ALT and the AST enzymes. Ethambutol, they can cause optic neuritis. So it can cause visual disturbances in the patient who is taking in ethambutol. And streptomycin causes tinnitus, so ringing of the ears. So that's it, guys, for antibiotics. And I hope you have enjoyed the mnemonics I've sent you through Messenger. I hope you had a good laugh about those mnemonics regarding the suffixes and prefixes of the antibiotics. So if you have any questions about my lecture for antibiotics, just send me a message and I would be more than glad to help you out with that. Again, thank you very much and have a great day.